Hi everyone, I'm Dr. Harib Ezaldein. I'm a board-certified dermatologist and skin cancer surgeon here in Miami, Florida. And today we're going to go over the top 3 questions that my patients with Hidradenitis Suppurativa ask me when we meet each other for the first time. Number 1, how on earth did I get this? The etiology of hidradenitis is unclear at this time, though it's believed to be a combination of follicular dysbiosis, meaning the abnormal growth of bacteria and fungi within the follicular microbiome, or essentially the epithelium or the lining of the hair follicles, that may result in the condition of hidradenitis. But it's unclear whether this came first or if the body just happens to mount an exuberant or an extremely strong immune response to something within the follicular epithelium, or essentially proteins of the cells that line the follicular lining, such as the hair follicle or the sweat gland, etc. The earlier literature pertaining to hidradenitis seemed to suggest that this may have started with the apocrine sweat glands, which is a type of sweat gland that you tend to see in the armpits, in the groin, in all the characteristic areas of hidradenitis. Although this is starting to become a little bit more of an antiquated theory, in the sense that we are now realizing that it might be more or less the immune response that starts to something from the cells that line the follicles, or maybe just the bacteria that inhabit the follicles, rather than something going incorrectly with the sweat glands. So it's essentially a game of chicken and egg, and no one really knows what comes first, but we seem to think that maybe it's something that triggers the immune system to have a very strong reaction, and perhaps this results in all the downstream issues that you see with hidradenitis, such as the nodules, the cysts, the drainage, the itching, the pain, all of that. And so with that, question number 2 is, am I contagious? Will I affect my partner? Can I go into a pool? Can I go into public places and not worry about infecting everybody? And that's a very fantastic question, because at first it may seem like what you have is a bacterial infection, but in reality, it's essentially bacteria that colonize the tracts and the lining of the hidradenitis diseased skin that result in the inflammation and sort of propagate this skin condition into getting worse and worse. And so the short answer is, you're not contagious. You could go into pools. You're not going to endanger a partner or a friend or anybody with this condition. If anything, this condition is quite stable when treated correctly and managed effectively. Patient. And finally, that brings us to question number 3. Is it better to manage this condition with medicine, such as topicals, creams, ointments, solutions, or should I manage this with medications that I take orally, or should we just go straight for the surgery with lasers or traditional surgeries? And the correct answer for this is, you actually need a combination of all of the above, in the sense that for milder diseases, you can probably get away with things like laser hair removal, probably even a few topicals, but for more moderate condition levels, you might need something more strong, such as antibiotics, such as other types of immunosuppression, like biologics, for instance. Some of them are injectables, and soon we'll be having a couple orals that will be available. And ultimately, surgery is the most definitive treatment for this condition. So I tend to reserve surgery for patients who are very well controlled in a combination of topicals and orals, and sometimes even injectable biologics. But you cannot just go straight to surgery without having adequate control, if that answers the question. And so overall, this is a condition where we know it starts from the hair follicle, whether it's the lining of the hair follicles that do something to trigger the immune system, we don't know. Whether it's the bacteria or the fungi that inhabit the follicles that trigger it, we're not sure. But we know that the downstream implications lead to chronic scarring, sinus tract formation, tons of discharge and pain. And number 2, it is not a contagious disease. It is something that needs to be well managed, but certainly not something that you have to worry about when going into a public condition, especially if it's well managed and you're not draining, etc., etc. And then finally, the condition is best managed with surgery. I think is best managed in patients who are very well controlled with topicals, with orals, with injectables. There are various combinations and every patient is different, but certainly I recommend treating this condition surgically and just getting rid of it once and for all. So I hope I answered your top 3 questions. Looking forward to hearing your comments below, and of course, let me know what else you guys would like to talk about.